Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Was on the front page of the Washington Post this morning, which was the fact that we've talked about xenotransplantation for a while, which is transplantation between members of other species and us. And we'd mentioned the fact that they had done a kidney transplant between a pig and a human, and that organ has survived in a brain dead person for about a month now. And so that was on the front page of the Washington Post. And that's an article we also have included. But I thought it was spectacular that xenotransplantation is right around the corner, as well as the rest of the regenerative medicine efforts, stem cell, et cetera, which will maybe obviate the shortcoming that we have because we have a gap between the donors and recipients, which is about 60,000, and about 17 people die every day because of the shortage of donors. And so the xenotransplantation may well be the answer to that, with the pig being the model that is commonly used. Okay, just so John, you can start the articles now. It's interesting how we talk about the obstacles that we have in being Black, and many times when they put obstacles in front of us, this accelerates our willingness to overcome the obstacles. And so here's a girl of color told she couldn't do well, but of course we've all been through that, I'm sure. But she's starting college at the age of 14. You folks have children and grandchildren that have had Head Starts. What do you think about that process of having a child of 14 starting college? I'm not concerned about the fact that she will do the work, because I'm sure she will. But what's the impact of you guys are teachers, a lot of you. What's the impact of having somebody that young being in college? And at 12 being in high school. What are your thoughts as teachers? How do you react to those child geniuses, so to speak?
If I were ever put in that situation, it would be an inspiration for me, to see a young person that young succeed like that. And it is a challenge, though, because kids are jealous of each other, and they try to sometimes they try to hold each other back rather than support each other. So I'll be very protective of that very young person coming in, and supportive. For me, it would probably be overboard. Probably go way out of my way for somebody like that who is that interested in science. So there it is.
Any other thoughts? How about the social ramifications of? I remember growing up with a guy who was my pianist, and he was precocious like this, and it was kind of devastating on his social life. He always was a misfit. And anyway, additional thoughts about that, you educators?
I think about balance, with her peers, still letting her, go, be a child as she progresses in her studies. But I think that there should be a balance.
How do you create that balance? Here you got somebody who's 14, who's with college students. How do you think you create that balance? That's easy to say. It's hard to do.
Personally, she needs to stay at home while she goes to school
Mhm.
and just go to classes and socialize with it. But going off to school, living in the dorms,
No.
I personally wouldn't say no. I would just say no, because even high school, getting thrown into that, just going to classes and coming home and then socialize with their own peers, as far as that time. But just going to school and coming home, that's it. Until she's mature enough.
Right.
And they're never mature enough, but
Mhm.
but I think this article is just stating the discrimination that she had to
Mhm.
go across so much.
Yeah, no, we all have that. It doesn't
Uh-huh.
talk about the socialization that the balance of the socialization that is essential. I think you're hitting on it, but that's tough to do. How do you get a 14-year-old to understand that you want her to go to class, but you want her to come home and not socialize with what they would call her peers, but who are much older than her?
Well, they had so much, and I think Janet's experienced it with her grandson, and my granddaughter went to the same high school, where the first couple of years of high school, but of course they were with their right age. They
Right.
kept them on PG County College and kept them in closed classrooms, and then they didn't start socializing until with the rest of the college students until their junior and senior year. And that's the biggest thing. Take them to school, let them go to classes, and bring them back home. As far as the socialization, our society has so much now outside, whether it's sports or whatever you want for your child, even private lessons, that kids, even homeschool kids, can socialize with their own peers, with their own age group. So that's not the problem so much. Even though she says she loves jazz and pop, they had so many extra outside of school area that kids can participate.
Well,
Any-
I've got a perspective. Um, when I from fifth grade through high school, well, fifth grade up to high school, I was in what they call accelerated classes for gifted students, students that tested 130 or above on the IQ test, and I was 155. And so kids that are gifted, they have their own pace, and their own following their own pace is more important than socialization. Um, Probably everybody in my class should have graduated college by the time they were 12, 13, or 14. That would have been the right pace for us. But since we didn't, we got the socialization, but just about everybody in my class underperformed according to their real expectations. Um, so you got that to look at. If I was in college at 13 or 14, I wouldn't have got caught up in the social scene because the older kids wouldn't want to have anything to do with me because I was too young. I would be young enough where I could really focus on accomplishing everything to my potential. Yeah, you'd have a problem when you got a 14-year-old that's graduated college and they're too young to start the work world, but that's a minor problem compared to maximizing their potential.
Any other thoughts on the subject? It's good to hear the balance.
It is balanced, but I feel too that 14 going to college, 12 going to college, it puts pressure on the student. Obviously, you're there because you're bright, you're gifted, but I would think it's a problem with fitting in. Going to school is one thing, but there's so many things going on in college that's after school hours, after the normal curriculum. And how do you fit in? Where is that balance? And Carol, you're right. With our kids going to PG, they're kids. And the first 2 years of that high school, they were with the kids. And then when they became juniors, they're with these adults. And my grandson went there and he had a little problem adjusting, but he said he learned from the older people, not only school work, but other things. They became friends. But to live in an environment with senior as opposed to junior high school and much older students, to live in that type of environment, I think it puts added pressure on them. Obviously, she did well, but would the average student do as well?
My thought on it is that as this particular person excels academically, I think my thought is that it corresponds to socialization. She would be very intelligent in socialization, and she would be equally gifted academically as she would socially.
Why would you say that? Based upon what do you say that? Because one doesn't necessarily have anything to do with the other.
I'm thinking, my thought is, we're talking about general intelligence levels. If you have a general intelligence level that's very high, then I think, that's just my thought, is that it also corresponds to your intelligence as far as socialization is concerned.
I don't agree, and based upon my experience with many of the gifted kids, it doesn't. Sometimes, for example, LaSalle LaFall was my professor and mentor. He was one of the rare people I've met who had that balance that where he was intellectually gifted, but he also was socially balanced. But most of the other gifted kids that I met were socially unbalanced, and they kind of were misfits. But I think the ability to have the two together isn't always present. For example, with Darryl, it may have been present, but there are a lot of the so-called gifted kids who don't have that balance, and they become misfits. So I'm just saying that they aren't necessarily together, the social skills as well as the intellectual skills and gifts. And that's where the parenting has to play a major role in trying to do the things that Janice and Carol talked about. Carol, it would be interesting to hear your perspective since your little brother was going through that. How did you see him from your eyes? Carol, you still there? Or maybe you'd rather not say, huh?
No, it's she had to step away.
Oh, okay. All right. Well, it'd be interesting to hear somebody else speak who knew Darryl as he grew up, and to see how socially balanced he was as he was so intellectually gifted.
From what I know about Darryl is that he has been very competitive all of his life. So not only did he compete, academically and musically, but sports, chess, he adjusted in every category, in my opinion.
Yeah, and that's unique and that's special, and people like that are actually very rare. I've encountered a number of them as I went through my career, and I've found some of them were misfits, some of them fit in very well. So, and I don't know what makes the difference. Why is one a misfit and the other just well balanced? Any thoughts or ideas on that?
Yeah, John, the check's in the mail. Thank you. Yeah, but I would think that social intelligence and intellectual intelligence, I don't see any correlation. I'll just leave it at that.
Yeah, I that's been my experience as well.
Yeah,
Yeah.
Dr.
I
Atto has
think
his hand up. Yeah.
I think the parental influence has a lot to do
Yes,
with
yes,
adjustment of
yes.
a younger child, because if they are treated as age appropriate as a child at home, that's one thing. But if the parents recognize the high IQ, the special gifted child, they must readjust to present them with a more an older child's view of life and treat them as such. It's but if you confine them to age appropriate activity, then they will be maladjusted when they get in college at a very young age. There's no doubt about that.
Dr. Atto, you had a comment?
Yes, there's a similar situation in 2013, where a girl from New Jersey, although she's not Black, but she is of Asian descent. You know, she finished high school at the age of 9 and finished college at the age of, I think, 12, and got her PhD at the age of, I think, 18 or 17, PhD. But her area was on computer. She was a computer wizard from New Jersey. You know, I think once in a while we see, you know, these talents, these, you know, children come up, you know, they are just endowed with special skills. And then their parents, you know, foster, because when they profiled her upbringing, her parents have a lot to do with her, you know, excellence in from elementary school, how she skipped many grades, you know, because of her academic performances. So once in a while, we see some of these, you know, excellent performances from these kids. Yep.
Joyce, you had a comment? Joyce, your hand is up. You're mute.
Yes, my comment is that everything that everyone is saying is absolutely targeted and true, but parents and the student or the young person must have an open communication, and parents should be put more emphasis on that with the child to make sure that they stay open and communicate things that they are experiencing and not experiencing, because we all know that young people, young adults, they can be kind of mean. And with that, and we hear a lot of children now being placed in stressful situations, and they get captured and they don't know how to recover for them. But I think if the parent and the student or the child have a very open communication and talk to each other, I think that that would be really helpful.
Elizabeth, you had a comment?
Yes, good morning, everyone. I agree with what has been said. And I was thinking about the fact that I am a child of 8. And I was the middle child. So my sister was very, very smart. And my mother always encouraged the rest of us that we were smart too. But in that, I ended up in some of her classes. In college, I ended up in classes above those on the dean list. And I treated it as, but one thing my mother did and my father did do, they kept me, not only did I excel academic, but I excel in my community connection as well as my family connection. Because even though I was tagging behind my older sister to learn what she'd learned, my mother also had me to support my other siblings, because she was the oldest and I was second, so it was five under me. Well, six, but five under me. And so I had to help them. And so, but I think the most important things, whether you're gifted, whether you're average, or no matter what status you're in, that parental influence, connection, and keeping you grounded is so vital, so important. Because with me, I finished college in 3 years. I would have finished faster if there was more months in the summer. But I think that connection to social and age is so important. I think being gifted is a gift that we treasure. But I think I agree with everyone. That parental influence and connection and communication, and that open communication, that dialogue starts day one or before day one. And so extending that, whether your child is gifted or not, is so imperative, so urgent, so important, because that's what we do in the classroom. When the child first walked in, we make a relationship connection, and we make that relationship connection that extends to that family. So keeping that child holistic and well-rounded is so urgent and important.
I had this one more thing to say. And I don't think, even though the parents are participating, there's so much that children, no matter if they were past generation or this generation. And I want to use my brother as an example again. When he was in 4th and 5th grade, they put those talented and gifted kids in a high school setting. And that's where their classes were. The parents couldn't have been around while the other kids were intimidating these kids, and majority, 9/8 of them, such thing, were white. He was the only black. The black kids, it was a black high school. They intimidated and wanted to beat up these kids in this talented and gifted. So my brother thought of a unique scheme, which he got in trouble from, but it was to protect those other boys and girls in their classes from getting beat up. So he started a insurance agent where they would pay him, and his thing was if they kept together, they wouldn't get beat up. But he gave them insurance papers so they would have to sign and pledge that he would keep them from being beat up. Now, if the parents were involved, the parents couldn't go with them to school, monitor them, and etc. I had a little girl when I was teaching 3rd grade at Amadon. The kids in the neighborhood, because of the color she was, and her father was middle class, and they weren't. I had to protect her by not letting her go outside and play, because the moment I would turn my back, someone would taunt her, hit her, or even want to fight her. Now, I'm a teacher protecting her, and I advise her parents, take her out of this school, because she needed to have recess and etc. There's so much, she could tell her parents that these kids are beating her up, and the only thing you can do to protect your child is to take them out of that environment where they might excel, go super glad. But she did fine. This child right here, socialization, nobody really, we don't know if she reported or not, but kids will intimidate, they will tease, they will pick at the kids. And if it happened to us in our generation, like my brother, my mother said it happened to her too when she was skipped and everything. Now in education, they no longer skip children. They hardly keep them back. They push them forward because all children can exceed, and they're really handicapping children. But all of this is to say, I don't know what you would do, but no matter how much the parents are involved, that socialization of going to class, college is a little bit different. Just go to class and get out and go home. You don't have to socialize with the people. But high school, going to class, passing from classroom to classroom, they'll say, oh, isn't that cute, sweet? And some high schools, they're really nice and they won't bother the kids. Other high schools, no matter what you do, no matter how much you tell kids not to bully and all that kind of stuff, it's going to happen. Thank you.
Okay,
Thanks, Carol. My principal called it an extortion racket. He didn't call it insurance. But when you're young going to school, with older kids, you got to learn. You got to know how to fight. And being tall helps. My father taught me how to fight. My mother fought when she was a kid, so she had that attitude. So I got that attitude. I'd recommend. This is America. It's tough for kids growing up. Get your kids in some martial arts classes, and both boys and girls, so they know how to fight. It's important.
Okay, we've talked enough about it. Let's move to the next subject. Thank you for those wonderful comments.
Dr. Callender, I just had one thing to say really quickly though. The thing I have highlighted, sometimes what the teacher might say to the kid can have lasting impact. The principal, her 5th grade principal, told her that Black girls, and the principal was Black, so we have to be really careful what we say to these kids. That's really all I wanted to say. Thanks.
Okay, let's go to the next one.
One quick joy before you go on. You mentioned learning how to fight. Well, today the kids carry guns and knives, so it's not to be considered.
That's sad, isn't it?
No, that's because if you fight, you get put out. The person if you get attacked, you get put out. The person that attacked you get put out, and sometimes expelled from the school period. They don't care who starts it. Kids are no longer allowed to fight. So the only thing they're going to do is to end it is either shoot you or knife you, and they're going to get expelled anyway. So they get it over with. If they just let kids fight like they used to, it'd be much better. But you can't even touch a teacher. Teacher can't touch you. Nobody can touch. There's no human touch. So, getting along. Okay, never mind. Okay, go on.
Okay, thank you very much for all of those points of view. They're all good. This is an article that the CEO of the hospital sent on, and it's a story about how this riverboat was blocked by they had a private boat that had a space, and somebody took the space, and the guy, in his efforts to get his space, was being brutally beaten up, but people intervened. And because they intervened, the attackers were prevented from killing the captain. And I guess the moral of the story is that we have to, when we see, it's interesting because many of the events that happen that are horrific, people take pictures, but they don't do anything to help. And the moral of the story is that we've got to be willing to help out. And if we're not going to help out, maybe nobody else will. In this situation, they actually helped out. And the moral of the story is that many times we are so afraid of helping out that all we do is take videos. And the motivation of this article is that help can be on the way, but you have to be that help. Of course, nowadays, most people are afraid to help out because they might be killed as well. But if you're not going to be the helper, who will be? Any thoughts on that? As many of us have faced that situation. I remember I was on the subway, and these youngsters were attacking this Asian couple.
Mm.
And I intervened, of course, in many ways. I intervened because I thought that the metro communication system was working and that you could actually call the police. And so I pressed the button thinking that it would get the police. Police never came, but the kids, because I intervened, they stopped fighting this guy. So, Mark, you had some comments.
Yeah, very quickly, perhaps I could argue that perhaps in certain situations, recording the incident and properly reporting it to the authorities can be of help. You know, I can see how just recording it, you know, just for your own consumption, that's pretty selfish. But you know, perhaps if someone records it and, you know, reports it to the proper authorities, you know, cases can be made in the proper way. So, you know, so if you're not in a position to help physically, you know, if there's no call buttons or anything like that nearby, you know, perhaps recording could be of help. Just a thought.
Any other thoughts? Thomas?
Yeah, Black Panther Party was designed to be an intervention group against domestic terrorists such as right-wing Klan organizations and police brutality. It's too bad we still don't have that. But, you know, Black Panthers were eliminated when the government firebombed them and killed them in Philadelphia.
Any other comments? Okay. Now, this is the article that we talked about on the start of the program that, as you know, we talked about this last year, that they'd done this genetically altered pig kidney into a brain dead man, but we never knew what happened after that. But what they're telling us is that a month later, the kidney continued to function well. And this would be the first time that they've had this kind of long-term, it's short-term, but relatively long-term function without having immunosuppression. And this is because the pig kidney was genetically altered so that the antigen that was causing the hyperacute rejection was eliminated. And of course, since we have such a gap, this kind of success may well lead to what we call xenotransplantation, becoming something to help us, since we have such a disparity between those people donating close to 40,000 transplants a year, while we have 100,000 people who are on the waiting list. So this augurs well for our future, in which transplanted pig kidneys, which are already genetically altered, can be used. Jamie Locke is doing this in the University of Alabama, and but Bob Montgomery is the one who took it, and not only to a day or to 5 days, but actually to 30 days. Any comments on xenotransplantation and whether or not you would be willing, if you knew that you would die without a transplant, would accept a kidney from a pig? Any comments?
Yeah, the John Buchanan, it'd be cool if we could do a quick poll on you. I think since you're the administrator, we could do a quick poll on who would take a xenotransplant and who wouldn't.
Well, I would. Anybody else speak up?
I wouldn't. This is Sylvia. I don't know. It's just a phobia.
I would.
I'd take it.
Anybody else to speak up?
I wouldn't. No, I wouldn't.
Okay, so anybody else? So the majority would, but there are some who would not. So, of course, it's easy for us to say because, and he's giving us an opportunity to answer yes or no, but it actually didn't give you a chance to vote. But it's easy for us to say when you're not dying, to say whether or not you would accept the organ or not. But when you're at the point of death, that's the time that the question becomes easier or more difficult to answer, because then the question is, do you know that you're actually going to die if you don't have the transplant? And it's that time when some people would change their minds. But the majority of people, it seemed like, said yes, but there were a number of dissenters, and that's probably the way it was. You know, when we had this question on TV a decade or two ago. About 90% of the people who were faced with this said yes, but there's at least 10% who would say no. So, but it's an issue that we're going to come to grips with over the next 5 to 10 years.
Dr. Atto.
Yeah, this very news was on ABC yesterday. This very article you are talking about, and this according to what you are saying, the genetically modified the gene for rejection that rejects the transplant. But my question is, how long? This is somebody who is brain dead, I guess. How long will this person survive? How long will he live?
Not long, because when the brain ceases to function, within a period of time, the organs, the heart stops beating and all that. So it's hard to tell because what they are having to do is to use extraordinary efforts to keep the organs functioning while the patient is brain dead. But and the reason that in the past, for example, in the Alabama study, they stopped was because in deference to the person who was brain dead, and so that they stopped within days because the donor family was not desirous of them going longer. So it's not that they couldn't go longer, but that they didn't because of deference to the donor family. But it's unreasonable for them to go much longer than 30 days because it's just, it's something that goes against the grain.
Dr. Callender, I know when James received his kidney, one of the things that he talked about was his desire for things that he did not desire prior to receiving the kidney. With the pig, and I see right here that they have 1,000 proteins that humans don't have. But has research been done to find out how the chemical makeup from the pig would somehow change the chemical makeup of the human?
No, that has not been done because we haven't done xenotransplants. So that would we'd have to do it to find out. Yeah. But no, the answer to that question, that has not been done.
Yeah, but
and that's
so
why
far
some people
looks
said
like
no. Probably. Go ahead, Darryl.
yeah, with organ transplants, if I remember correctly, there's been no change to DNA of the recipients, although there has been some DNA change with bone marrow transplants. But this is an organ transplant, and so if things stay the same, there shouldn't be any DNA changes.
The proof of the pudding will be the eating, and so the expectation is that there wouldn't be a change, but we wouldn't really know until it's actually done and it's been allowed to the organ allowed to exist for years, and that has not been the case. The longest for a xenotransplant surviving has probably been around 60 days. because the rejection was the biggest obstacle, which the genetic modification of the pig has overcome. But the expectation is, as Darryl has said, is that we wouldn't have it, but whether that's borne out in the long run, time will tell. It's interesting that we still have the issue of insulin being expensive, and Amazon Pharmacy has tried to deal with this by allowing lowering the price, and also Medicare has also reduced it so that that issue is becoming less and less of a problem. It was a dramatic problem a year ago because people were being forced to take half of the amount of medicine that they wanted to take because they couldn't afford it. So the search for discounted insulin was very great. Now with Medicare making the changes, it's not as acute as it once was.
Can they come back and look?
Okay, any diabetics who have experienced this, or any comments? Okay, so this is a problem that has become acute, but it is being addressed by a number of sources. So this particularly affects the type 1 diabetics because they require insulin to survive. Okay, let's go to the next one. This is an article that flies in the face of many other articles that talk about 1 drink a day is good for women, and maybe 3 drinks a day is good for men. But this says even 1 drink a day is associated with increase in blood pressure. And this is based upon a study that they published in hypertension. The question is that still remains to be seen is the type of patients they're talking about. For example, this data talks about Korean, US, and Japanese people, and the number is only 19,000. And it doesn't talk about how many people of color are involved in this. And I think that becomes an issue as well. But it's interesting, though, that it does bring up an issue. An issue that just bothers me is the fact that 1 drink a day for an alcoholic results in them not being able to stop drinking. So that while it may be good for the stomach's sake, if you're an alcoholic, not good at all. And so for many, it's better not to drink at all. But anyway, this article then points out why that even 1 drink a day is associated with increasing blood pressure. In the past, we've talked about alcohol, but not really paid attention to the impact upon blood pressure. This is an article that talks about the fact that while it may be bad for the liver, it's also elevates the blood pressure. Any comments or thoughts about this interesting new perspective?
Dr. Callender, would be interesting to know if the test group had normal blood pressure levels as opposed to a person that is taking blood pressure medicine to keep their blood pressure down.
Yeah, it doesn't say, but the impression is that these people had normal blood pressures, but it doesn't go into detail. Now, this is a very remarkable article in that it talks about Dr. Gupta and his experiences, how he used to be opposed to cannabis. And one of the things that he happened to notice is that in seniors who took cannabis for pain and other things, that it worked. And as we had mentioned, it has been used for glaucoma and it has been used for pain relief. And he is now convinced that cannabis is helpful, as we all know, for some things. It has its side effects, but it is helpful for pain without question, and for some it's helpful for insomnia. But it is clear that cannabis does have a medical role in handling people who have pain, and especially in seniors who have this, but actually it's true in adults as well. Any comments on the value? It does have its side effects, but it has its merits as well. And every drug that I know of has side effects as well. So
Yeah, for me, Dr. Callender, just smoking anything, if the method of application is smoking, is an issue because of the extra toxins that get carried into the lungs. But you know,
well, smoking is not the only way it's administered.
yes,
Yeah, you're right about the smoking, but cannabis is administered by other routes as well.
I would just suspect that the edibles are probably loaded with sugar.
I don't know, and it does. This article doesn't address that aspect of
You probably can get to sleep faster if you smoke it, though.
it. I don't know. It doesn't. The article doesn't talk about the routes of administration of cannabis. Some people actually also recognize that cannabis is an anti-rejection medicine that has been used to decrease the incidence of rejection and transplantation as well. So, but they don't talk about the route of administration because it can be administered subcutaneously, PO, and intravenously.
I just did a search on cannabis edibles and it says, quite frankly, they're full of calories and sugar that are bad for you.
There's an interesting story about overdoing it and with the edibles that you talked about.
You go back to that picture of the guy on the ladder, who's harvesting cannabis. You know, that would be really bad if he fell off the ladder.
Any other comments about cannabis and its medicinal value?
Yeah, you said cannabis may be more beneficial to seniors and adults than maybe younger adults. In which way? I mean, as a pain reliever?
Yes, pain reliever and also insomnia as well. Yeah, and as we know, for glaucoma, but yes. So it's been used in young and old. It just seems to have relatively more effect on the older, but the young people have been using it for forever anyway.
So as one is aging and then is experiencing back pain, knee pain, elbow pain. Do you recommend the person to be taking marijuana?
No, I don't, but the evidence is suggestive that it can relieve pain. And that's an additional medication that is available for those who have pain that doesn't respond to anything else.
Okay.
As we all know, that CPAP is a treatment that is used to treat obstructive sleep apnea, which where people who have difficulty breathing because they don't have adequate oxygen level use CPAP, which allows the oxygen level to stay up. And this then eliminates the problems that they have with hypertension and other consequences of low oxygen levels. The CPAP then, of course, is one of the treatments of choice for obstructive sleep apnea. The fact that the oxygen level stays at an appropriate level throughout the night makes a tremendous difference in terms of complications that occur because of hypoxia or the lack of oxygen. Snoring is one of the most common manifestations of sleep apnea. And as a consequence of the fact that you don't get enough oxygen, you don't get enough sleep, you're tired all the time, your blood pressure's up, and many other things go along with that. Many people go undiagnosed, one, because they don't have a partner who sleeps with them, so they may not know that they're snoring. And others just don't realize that it causes many complications that result in the early death. As you know, morbid obesity is a problem that can cause obstructive sleep apnea, having tonsils, tonsillitis, and those kind of things. Also, or adenoids or other things that can obstruct your ability to oxygenate. The thing about the CPAP is that you have to sleep with it at night, so your social interactions with people at night become problematic. So a lot of people are reluctant to use it. Once they start using it, the benefits are so obvious that most people are willing to take CPAP because it lengthens their lives. If you think you have sleep apnea, what you can do is go to the hospital and get a sleep test. And while you're sleeping, they do tests and find out about your ability to oxygenate. And so without having a sleep test, it's hard to make a diagnosis of obstructive sleep apnea.
My name is Mark Tatum. I'm 46 years old, and I use a CPAP machine.
And what do you think about it, using it at night?
Just like how you said, it is uncomfortable. It's something that I'm still trying to get used to. But I do notice a difference when I use it. There's some nights where I've skipped it or tried to skip it, and it has made a difference. And before the CPAP machine, I was always tired. I was constantly fatigued. I would get like 6 to 7 to 8 hours of sleep at night, but wondering why I was still like fatigued and tired all the time. But this CPAP machine, it does make a difference. I'm only like 3 or 4 months in using it, but I could tell it's making a difference.
Yeah, I'm
Yeah.
John Cannon. I'm 73 and I use the CPAP. I've been using it for about 6 years now. And I even use it when I take a nap. It has stopped my snoring, even though I have mild uh, uh, disruptive sleep apnea. My son Kareem has very heavy. I forget the terminology for it, but he has like 70%. Mine is like 17% obstructive. He has severe obstructive sleep apnea, and my spouse also has severe obstructive sleep apnea.
Can you scroll back to the top of the article? I missed that. Thank you.
John, how long did it take you to get used to CPAP?
That's a good question. I wanted to stop snoring, so I kind of did it right away. And I'm uncomfortable if I don't have it now. I recommend it. It's something to get used to. It's and I've recommended it to some friends of mine. They said, no, I'm not going to do it. Got the tube hanging all over you. I don't even notice the tube that goes through the machine. Don't even notice it.
Yeah, I went to an ENT and he told me I didn't have sleep apnea, but he said I would sleep better if I used nasal strips. And that's true. So I use a nasal strip and I do sleep a little better.
Mark, how long did it take you to get used to this CPAP?
Yeah, I'm still not all the way used to it. I fall asleep anyway because I'm just legitimately tired, so I just deal with it. Sometimes, some nights I've woken up and felt uncomfortable and taken it off to my detriment. So yeah, so truth be told, yeah, I'm still not all the way used to it.
John, Buchanan, did you take a while for you to get used to it, or you, as soon as you started using it, the benefit was so obvious you just kept doing it?
I think that's the case. Yeah, I just started using it and kept using it, and when I went back for my checkup, I took my machine and they record the quality of your sleep, the seal on the mask, how long you sleep with it, and they said I had like 98%, which is A plus on usage. So they said they had never seen anybody who had that that highest score. But also they can record your sleep over the internet as well. So I know how somebody might feel about that, but you can track your sleep as well.
Mark, did you have another comment or no? Okay.
No,
Well,
no, I was just congratulating John Buchanan because he said he even takes it during the nap. I haven't. That's you're very good with that. I got to get to that level. I got to get to where you are one day, sir.
Okay, call me anytime.
okay. All right. Thank you very much for that response, because it's good to hear. Now, this is not surprising, but the fact that sleep and immunity are linked together, and that if you have poor sleep, you have a diminished immune response, and the need to have 7 to 9 hours of sleep a night does wonders for the immune system. And this is an article that points out that that if you're able to sleep well, that you're able to respond to infections and other things better. That sleep and immune system work together to keep you alive. And this shows that there weren't, to me, 164 adults. Is not a huge study. but it does identify that the antibody response is greater when you sleep well, and it goes down when you sleep less. Understanding the immune system, you recognize that having an intact immune system helps you with cancer as well, because many instances, cancer is a result of an immune deficiency or the inability to kill the cancer cells. And so good sleep does help with that, although we know that there are antibodies, autoantibodies, that knock out the cells that are responsible for killing cancer cells. And so one of the treatments for cancer is to use these antibodies to knock out the autoantibodies that are preventing our immune system from functioning appropriately.
Okay, so what I don't understand is Donald Trump gets between 4 and 5 hours of sleep a night and eats McDonald's and Kentucky Fried. How does he do that?
What do you mean? How does he do it? Many people
Stay
do.
alive. How is he still? He's 77 and
yeah, that's a question.
Individuals are different.
It is amazing.
I said the proof is in the pudding. Is it evidence? Is it evidence based?
I think he's nodding off. He's taking naps. He's taking micro naps throughout the day. He'll be at a press briefing and just kind of nod off. I mean, that doesn't count towards cumulative sleep, but that I don't think I doubt that he's seriously staying up the entire day. I seriously do.
But also, you got to keep in mind that his brain is not functioning very well.
Yep, there are a number of, one of the things that we've talked about for quite a while is the fact that sleep allows your brain to detoxify. And so when you don't sleep well, your brain is not as functional as it could be.
Case in point.
Yes, John?
Trump is a case in point.
Well, no comment. There's an article that is complex, but it takes both points of view. Talking about naps that are short, about an hour long, seem to be good for the brain. Naps that are longer than that seem not to be associated with a great mental ability, based upon the studies that they've done here. And so it seems that short naps, now the exception is when you have a sleep debt, where you don't get enough nighttime sleep, then you have a different situation, because what you're doing is trying to repay your sleep debt, which is a little different from the naps that they're talking about. And so the naps that they talk about that are of merit are those that are less than 60 minutes. Longer than that, they're not thought to be helpful, and it is also thought that dementia is associated with long naps in older adults. Sometimes one thing causes the other, and Alzheimer may cause you to sleep more, and therefore that may adversely influence the studies on longer naps, because as Alzheimer gets worse, you sleep more. But the short naps do appear to be very helpful. And most of the information indicates that the short naps allow the brain to relax and allow you to increase your cognitive abilities, whereas there's evidence that the longer naps do not do that. Any comment about those of you who nap? Okay, this article is an article that I put in here because it points out that just because we have good medicine that's helpful doesn't mean that people will take advantage of it. This shows that we've got a new treatment for hepatitis C, but yet only a third of the people who have hepatitis C have taken advantage of it, which is kind of disgraceful. But it's just like 17% of Americans have taken advantage of the vaccine, of the second vaccine. Only 17% have taken advantage of it. Similarly, here you have a cure for hepatitis C, and only a third of the people who have hepatitis C have actually taken the medicine to treat it. So it's one thing to have the medicine, it's another thing to have people take advantage of it. And one of the biggest problems is that 40% of the people who have hepatitis C don't even know they have it. And unless you get tested for it, you wouldn't know you have it either. So getting people tested is one of the first issues. Now, people who work in the hospital, they have to have testing. But people who don't work in the hospital may not get their tests.
Excuse me, Dr. Callender. So you're saying that if you have Hep C, you don't have any symptoms?
Well, Hep C may start off without symptoms, and very often it's only 20 to 30 years later you wind up with hepatitis, and you may wind up with cancer of the liver. So yes, initially it may be asymptomatic.
Dr. Callender, if you remember, David had hepatitis C, and I believe that's what led to the primary sclerosing cholangitis. And he had it for many, many years. He had hepatitis C as a very young child. And he had primary sclerosing cholangitis more than half his life, I guess. But that's not what ended his life. He had heart problems. But yes, he had for many years, and that's what caused him to have the transplants. He had 2 liver transplants because of it.
Any other comments? Ben?
Reynolds, can you hear me?
Yes.
Yeah, I also read in there that a lot of the people who did receive treatment varied based on whether they had insurance or whether they did not have insurance. And the people with the lowest rates of treatment were those who were under a certain age, I want to say under 34, without private insurance. So that's an issue too, it looks like from the article.
Well, the most of the Medicare, if you have Medicare, that would cover it. But you're right. Now, Gilead has actually has a program for those people who don't have insurance, so that they can get the medication even if they're not insured. But that is a part of the problem. And but I think a lot of it relates to knowing whether or not you have hepatitis C, because if you have hepatitis C, there are ways, whether you have insurance or not, you can get the medication. Actually, Gilead has a program that allows you to get the medication whether you're insured or not. I have a patient who actually has use this. And I think if there are people who have hepatitis C infection and they don't have any insurance at all, if you're a DC resident, you can get a Medicaid, which would pay for it. So now, if you're not a DC resident, I'm not sure, but I know a DC resident, you can get DC Medicaid, which would pay for the hepatitis. But your point is well taken that the uninsured have a less likelihood of being able to get the medication. So if they are DC residents, though, they can get DC Medicaid, which would pay for it. It's good to have you again on the program. And you did a great job on the webinar last week. You guys were sensational.
No, I told Dr. Melanson that you guys helped us look like we had some sense. That's what that was, I think.
Well, anyway, good to have you back again. It's good.
Thank you.
Congratulations on your success.
And I have to be in clinic next Thursday, so you won't see me next Thursday.
Anytime we see you, we're grateful to see you.
Okay, okay.
You're always welcome.
Thank you, thank you.
Okay. Well, you know, here's an issue. COVID is coming back, and people who wear masks and don't wear masks. You know, if you have COVID, the best thing to do is stay home. So you never tell anybody you stay home. And that's the best advice. Stay home until you're negative, and then you might come out again. But as far as telling people, you can tell them if you want to, but you should stay home until you're over it and you're COVID negative. We are seeing an increase in COVID cases, and there's still only 17% of Americans have taken the second booster shot for COVID. And so that would help if you get that. And then, of course, if you get a positive test, you need to stay home. And then, of course, if you don't improve within 3 to 5 days, you need to, especially if you're over 65, then you need to take the anti-COVID medications. We have 2 of them which are effective. Of course, if you have renal disease, then of course you can't take those medications. But so therefore, having been vaccinated.
Hey, that's the number, but I'm going to.
Any comments or question about this? Because this is something that, as we approach September, we have an article in here that talks about the fact that in September, they will start giving you the annual COVID shot, which is very similar to the annual influenza shot. And so the question is, for those of you who have not gotten the sixth vaccination or the second bivalent vaccine, whether you get this shot now, because within 6 months of the previous vaccines, it is thought that the immunity begins to wane. And unlike the vaccine that you get in September, which hopefully will give you a year's immunity, the immunity we have from the vaccine is thought to be 6 months. And after 6 months, it wanes. So, but it's interesting that the number of people who have been to the hospital and the number of people who have tested positive for COVID has been rising. And so this is a cause for concern. So the best advice is to get the bivalent vaccine if you haven't gotten it already. The other advice is continue to wear masks when you're inside. And there's a tendency to stop doing that because nobody else wears masks. And so So when you're indoors, it's wise, and it's the expectation that as the weather changes, that the COVID hospitalizations and the infections will increase. Any comment on this by those of you who are out there?
Yeah, I had my hand up. I had 3 of my friends over the past 3 weeks to come down with COVID. One had been traveling, went up to Detroit on the plane, and 2 other ones went out to concerts. One was indoors and one was outdoors. So yeah, it hasn't gone anywhere. And I think, you know, like one of my buddies said, it's sort of like the flu. If you're not careful, you can catch the flu, you know. So when you're indoors in close situations, I mean, I've even started wearing my mask in the grocery store again. I had stopped that because, you know, you get comfortable with the knowledge that you probably won't get sick. But there's more people getting it. When I go indoors, I'm gonna wear my mask.
Any other comments or thoughts as we, and of course, this is particularly important for the immunosuppressed patient to require vaccinations, and some for whom they do not get the immune response from the vaccine as others do. So with that in mind, wearing a mask when you're indoors is something that kind of is a must for transplanted or immune compromised patients, so people over 65.
This is especially relevant for me, I think, because I work at a high school.
Oh,
So
yeah.
that could be, you know, a minefield just going to work.
That's right. You're absolutely correct.
And I had a booster in January, so I guess I need another one. What, next month? I guess.
6 months is.
I had one in January. Oh no, so I'm overdue then.
Yes, yes, you are.
Okay.
Yeah.
I have a question for Dr. Callender.
Yes.
Last night I was in a session and they were saying something about the vaccine, and that you had to be 65 or older. Is that true?
For the RSV vaccine. All right, which vaccine? There are a number.
The new one.
RSV vaccine.
Yes.
Yeah, it is recommended for children or adults over 65. That's for the RSV vaccine, which is a problem for children and adults. Yeah. Now this is a article that a little surprising for some of us, because most people know about aerobic exercise, but not too many people know what isometric exercises are. And isometric exercises is a form of exercise that involves a static contraction of a muscle without any visible movement in the angle of the joint. So we talk a lot about aerobic exercises and weightlifting and so forth and so on, but rarely do we talk about isometric exercises. And it appears that when they analyzed with a large number of people studied, that you saw above, that the aerobic exercise was effective, but the one that was most effective at lowering blood pressure was isometric. Hand grip, wall squats, leg extension. So walking is also effective, but it's interesting that isometric, which we have rarely talked about, is an exercise that also is capable of lowering the blood pressure. So how many of you have used isometric exercise? I think many of us have used the aerobic exercise, and many of us have used weightlifting. Any of you out there have used the isometric exercises?
I do use fairly frequently. Hand squeezing, stretching, wall flexion.
How long do you do it, Lou?
I do, it's about 10 minutes. With hand exercise, it's like 20 contractions, 20 squeezings at a time, and do 3 sets of those in the morning and again at the evening. And stretching about once a day, and wall squats once or twice a day at most, and I do walking every day.
Wow, wonderful. Anybody else do isometric exercises?
I don't do it, but a lot of my friends that play tennis with me, they do it every day in the tennis courts. You know, squatting, leg stretching. They do it a lot. And most of my friends, I want to join them in doing that.
Any other comments about isometric exercises? Okay, well, it's good to hear that. So Lou is an expert on it, so we'll keep that in mind. Anyway, we talk about the best way to exercise. I think exercise speaks for itself, but sometimes we forget about the importance of weightlifting along with exercising, because the aerobic exercises are good. I think when you have that along with the weightlifting, I think you do a lot, and especially the concept that muscle is a good insulin sensitizer. The question is, should you do one or both, or a combination? And most of the evidence suggests that the aerobic exercise associated with weightlifting is ideal.
Callender, what does that mean? Insulin sensitivity. What does that mean?
Okay. The type 2 diabetes is diabetes in which you have enough insulin, but the insulin that you have is not effective. And so that means that your body may have antibodies to insulin. And yeah, I'd say so. Yeah, so that if you have antibodies to your own insulin, then you would get type 2 diabetes. Now, the treatment for this is exercise, weight loss, and this then allows your body to become more sensitive to the use of insulin. Because those people with type 2, it's not that they don't have enough insulin, it's that the insulin that they have is not effective. And that is why weight loss, your poll is not accurate, because I said yes, but they don't record it. But anyway, that's the answer to the question about insulin. Did you understand, or do I need to make it clearer?
I really didn't yet. I mean, I understand about type 1 and type 2, but
well, type 2 diabetes is where you've got enough insulin, but the insulin you have is not effective. And by losing weight and exercising, you may decrease whatever is causing your insulin to be ineffective, whether this is because of antibody production against the insulin, or because your insulin is the thought is that when you have type 2 diabetes, that your insulin is, there are antibodies to your insulin that protect your insulin from becoming effective. And it is the thought that the exercise and weight loss reduces those antibodies, and therefore your insulin becomes effective again. That's an oversimplification, but that's probably a way of explaining it, that the antibodies that are prohibiting or preventing your insulin from being effective are minimized or eliminated as a consequence of exercise and weight reduction. Does that help at all?
Maybe a little bit, but I'm just stuck on the word sensitivity. What do they mean by
It
insulin?
means that insulin works. It makes insulin work. Yeah.
Okay.
Makes your body sensitive to insulin. Anybody want to do a better job of explaining it to John?
When your blood glucose levels are high, that'll damage parts of the body, such as eyes, nerves, kidneys, blood vessels. And so what insulin does is it lowers your blood sugar levels. And so it normalizes you out. Your blood sugar levels go up, you can go into a diabetic coma. And so the more sensitive you are, the more your insulin works to lower your blood sugar levels.
That help? Still doesn't help, John?
I'm getting there. Thank you.
Okay, good try, Darryl. Okay. Okay. Lou, you got any other way of putting it?
Other than to say that I guess it's like if you have gasoline in a fire. If you have a fire and you add gasoline to it, then you're not responding to your insulin. If you add water to the fire, then it responds. So the insulin is sensitive. Does that make any difference? Still not clear?
Okay, well, we tried, but anyway, it's an important concept, and it's interesting because it's the same concept that they actually use for the treatment of cancer, because they have in your body you have what they call autoantibodies, and these antibodies prevent your immune system from working. And the treatment of cancer, they use antibodies against these autoantibodies to knock them out so that the immune system can effectively kill the cancer cells. And this kind of is what happens with type 2 diabetes, and that you have antibodies that knock out the body's ability to respond to insulin. And when you have exercise and weight loss, this then reduces the amount of these antibodies and allows the insulin to be effective. Anyway, sorry that we can't help you with that, but
maybe I'll just study on it. Thanks for trying.
Dr. Atto has a question.
Yeah, does the insulin work by helping to transfer the glucose, the sugar molecule, into the cell, or does it work in the mitochondrion of the cell?
it does both. Insulin does both because it actually forces, it actually gets your body to, as Darryl said, to lower the glucose level. And this then affects electrolyte. But the best manifestation of it is normalizing the blood sugar level.
Okay.
So when you have type 1, your body doesn't produce any insulin at all.
That's correct. and insulin is necessary to normalize the blood glucose.
That are in school, so it counts as an elective outside of school.
But actually, Dr. Atto's comment just addresses the way in which it acts in the cell to not only to reduce the glucose, but to actually get the movement of sodium and potassium in and out of the cell. We had, I didn't realize it's 10:30 already, but yes.
Hi, can I interrupt for just a minute? My
Yes.
granddaughter Kayla is on, and she is headed back to school, and she just wanted to pop in. I think some of the old members of the transplant group will remember her. And she just wanted to say hello to you, Dr. Callender, and the group. And I wanted her to meet Dr. Ivy because she's going back. This is her second year at Penn State.
Oh, that's very good.
The ultimate alumni.
Hi, everybody. How are you doing?
All right.
Hi.
Good to see you.
Good to see you all.
Yeah. Yeah. Did you see any? Did they have a statue of Lewis Ivy at Penn State?
No, not yet, but I'll be petitioning to get one put up.
I had a painting that I did up there in Old Main some years ago, but you know, that was a long time ago.
Oh, okay. I've actually never even been in the building. I don't know if it's still open like to students and stuff, but I go on the lawn a lot and I'll do like my studying there and stuff. But yeah.
What are you majoring in?
Data science.
Oh, really?
Yeah.
Oh, that's where the action is.
Yeah, I hope so.
Well, you know, Dr. Clarence Lang, he's the dean of the African American Studies.
I don't think so. I don't think I met him before.
Okay, well, let him know that I talked to you, and he'll do what he can to guide you in the right direction.
Thank you. I appreciate that. I'll definitely look out for him. What did you say his name was?
Clarence Lang, L-A-N-G.
Okay, thank you.
It's good to see you again. It's been a while. Welcome back to the group.
Thank you. It's good to be back.
Yeah, thank you. Well, thanks, Janice. That's
great. We're very proud of Kayla. And of course, she sees you, Dr. Callender, and the group as her support team. And, you know, she was coming on a regular basis when we had the virtual.
How could I forget?
Believe it or not, my granddaughter and grandson loved it.
Yeah,
they really enjoyed it. Yeah.
Okay, well, have a great year, Kayla.
Thank you. Thank you.
And say hello to your brother. For
I
me.
will. I will.
Okay. All right. Okay. Looks like this is the last slide, though. But physical activity is an effective intervention for mental health conditions. And put this in there just to remind something that has been talked about for a little while, and that is anxiety, depression, and psychological distress is treated as well by exercise. So it's something that we need to do. And it's interesting, 128,000 participants have been involved in this study that demonstrated that the cognitive aspects of mental health are improved by exercising. And since we all exercise, I think it's good for us as we age to recognize that exercise is for all, the young and the old. It's just that as you age, it becomes much more important in order to survive. And since we have so much anxiety and depression, psychological distress, and since when you're Black, you're stressed even more than ever, exercise becomes even more important. Okay, I guess this will be the last slide. And
this is my hand exerciser.
oh,
isometric.
Okay. For isometric exercise.
Yeah, you just squeeze it.
Great demonstration. And you do about how many of those?
20 at a time and about 3 sessions of those.
Mm-hmm. Wow, great, 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 great.
Can I see it again, Dr. Ivy, please? I'm not seeing it.
Yeah.
You don't see it?
No.
Hello? Can you see it?
I'm still
Anybody else?
not seeing it. Oh, okay, I see it now. That's
Hmm.
interesting.
Mhm. It's
Just-
adjustable. Tension
Show,
is adjustable.
show her how you do it, Lou.
I'm not seeing it.
You still can't see it, huh? Hmm. I don't know.
If you
why.
could hold- if you could hold it up a little bit higher, like where your face is.
I
You still
see it.
can't see it. Huh?
I see it.
Okay, all right. Looks easy to do.
Yeah.
Yeah.
That's
Okay,
good for
well,
your bone structure, is it?
Muscles and bones. Muscle primarily, and it keeps the joints active.
Dr. Ivy, would you say that's your main squeeze?
leave it to Darryl.
Yeah. Darryl is a bright fellow, I tell you.
Back to soul train.
Oh, boy.
Hey, look at Buchanan. Buchanan has another isometric exercise. See that, Janice, Joyce? You
Let
see,
me get Buchanan up.
you see him with his,
Yes, I see him.
yeah, with his ball. That's isometric exercise as well.
Well, I might as well show mine.
Uh-oh.
Okay, let's see yours, John.
Oh, Lord.
Look out.
Oh, that's your balls, huh? Okay.
Those are Chinese balls. You roll them around with your hand.
Yeah.
It's a
I
Chinese-
don't like my balls squeezed.
No, you don't squeeze them. You just roll them around in a circle in your hand.
I
But
see.
that's what
Okay.
they're called, Chinese balls.
Okay. All right. Well, thank you very much, everyone, and have a good weekend, and we'll see you next week. Thank you. Have a good Penn State. And think of Blue Ivy.
Bye.
Bye-bye.
Bye.
Okay.
Bye,
Have a great weekend.
Oh, Dennis, how's your house selling going?
You're muted, Janet.
Have a showing today and another one on Saturday. They're looking, but hasn't really hit yet. But I'm hopeful it'll happen very soon, hopefully.
Okay.
Yeah.
And John Reynolds, thanks again for joining us.
Oh, thank you.
Good to see you.
And actually, one of my sisters said she knows you, so I guess I have to act like I have some sense now, huh?
What's her name?
Leslie Williams. You worked with her
Oh.
daughter, Lauren.
Yeah, okay.
Or she said you helped Lauren out at one time.
Yeah, okay. Yeah.
Vicky's sister.
Well, that's wonderful. Well, tell her hi for me. Okay.
I would do that because she sent me a text last week after she saw the video.
Oh, okay. Wonderful.
Yeah.
Well, it's good to see you again. Yeah.
Thank you.
Okay. All right. Have a good weekend. Bye.
Okay, guys. Thanks. See you.
Yeah.
Bye for now.
Bye.
Have a good.